Good morning to everyone, our Peake ReLeaf community. This is Kevin. I'm the Director of Marketing at Peake ReLeaf. Today, I am joined by Warren Lemley, CEO of Peake ReLeaf, and our special guest, Eryck Stamper, Founder and Executive Director of Veterans Initiative 22. Part of these conversations that we're having surrounding the expungement clinics is talking about the importance not only for communities of color, but for additional minority communities, for additional segmented communities, for additional specialized communities that could take advantage of these types of expungement services. So with that being said, I'll hand it over to Warren to further introduce himself, and then we'll hand it over to Eryck to further introduce himself.
Thank you, Kevin. My name is Warren Lemley. I'm one of the founding members of Peake ReLeaf, and it's my honor to be here today with Eryck Stamper of Veterans Initiative 22. I've had the luck to work with Eryck on a couple of different projects throughout the years. Met him shortly after Peake ReLeaf's opening. He was one of the people that inspired much of the industry to honor 22% off for veterans in honor of a lot of these struggles that they are going through in their community. And I've actually been able to work with him on a lot of different lobbying efforts through medical cannabis related initiatives, adult use related initiatives, and even some social justice related initiatives. So it's my honor to be here with Eryck and work with him on these projects and try to support him and his organization as he tries to help our veterans community. Thank you, Eryck.
Thank you, Warren. Thank you, Kev. It's a pleasure to be here. We've had a lot of intricate workings together historically over the past, like you stated, which led us up to where we are today, to be honest with you. I'm Eryck Stamper with Veterans Initiative 22. In our words, we're trying to take care of our veterans in Maryland through cannabis, advocacy of resources, and employment. With that, back when you guys opened up the stores, kind of when we founded a nonprofit, Veterans Initiative 22. So 2018 were critical years. I know you guys just had your anniversary, so congratulations. And since then, there's no doubt that you're making a dramatic impact to the community around you. So thank you, guys.
Thank you very much, Eryck.
We definitely have appreciated the opportunity to work with you, Eryck, and to work with the veteran community, doing whatever is within our power, and even those things that might not be immediately within our power, but we know we have a responsibility to do and to work on. We count ourselves fortunate to have advocates like you in the community, because for a lot of our veterans, we've had, veterans that have worked on staff at Peake ReLeaf. A lot of times they don't feel like they have the representation that they feel that they need, especially in this industry. Sometimes they feel overlooked. Sometimes they feel, they've expressed to us that they feel like, having a discount is great, but, they want to see more. They want to see more done. They want to see people putting really their money where their mouth is in terms of the promises that they make to the veteran community, the types of assurances they make to the veteran community. And one of the things that, I'm hoping that, you can continue to share with us today is, the history of Veterans Initiative 22, the types of things that you're focusing on, and the types of things that businesses like ours, in addition to these types of expungement clinics, can do to support that veteran community.
Well, thank you. First of all, we've been in fruition since 2018, working really hard in our veteran community. Cannabis is a lifesaver. We wouldn't be here today talking about it if it didn't save my life personally. Veterans here in Maryland, we've got about 362,000 veterans. In our estimations, we don't have exact numbers from the MMCC, but I think in 2 years we'll have more precise and accurate data to share. We've got about 10 to 12,000 veterans that are enrolled in our medical cannabis program. And cannabis, like we said, is saving lives daily. It's helping people, especially the veteran community, come off opiates. We're suffering a lot of issues like PTSD, TBIs, and just dramatic amounts of veterans that are in our healthcare program in the state of Maryland. And with that comes problems. We got a lot of veterans in the community that are suffering, through homelessness, through legal issues and concerns. So like your projects, for example, the expungement clinics that you're offering, are allowing veterans as well as our community at large to relieve themselves of some of those legal burdens. We represent a good portion of our veterans, and there's a lot of programs in Maryland I think are critical to taking care of veterans. A lot of it is community-based. If you're familiar, we have the Veteran Treatment Court in the state of Maryland. So that alone, in efforts in concert with the expungement clinics, is a lot of legal recourse that our veterans can take to get themselves out of these legal binds. You'll see the vets in legal bindings probably more than you'll see your regular citizens of states. Through some of the damage and some of the efforts that they've incurred through combat in wartime as well as peacetime, they come back and they're suffering. And so that suffrage creates a lot of mental health issues, concerns, which rolls right into legal. So expungement clinics, we don't have the data, but I'm sure are helping our veterans get over some of those legal bindings that keep them oppressed and depressed. So we have a very extensive program in our legal system as well for veterans. We've got the Maryland Office of the Attorney General has released the Military Veteran Legal Resource Guide. I shared it recently with you guys, and this is a document, it's 40 pages. It's a commonwealth of knowledge, legal for our veterans in Maryland. They cover things like legal assistance, housing, homelessness, taxes, rights and protections of our veterans in Maryland. And that goes well with saying that our Veterans Administration healthcare programs, a lot of programs inclusive. So in partnership with the cannabis industry and the efforts that we're trying to do to employ our veterans, change policies in Annapolis and even at the federal level, expungement clinics and all these services, community outreach that you do, as well as all the dispensaries and as well as all the industry in Maryland. It's been a really good job. We're bringing a lot of jobs and opportunity to some communities that have otherwise been overlooked and are harmed by legal considerations and restraints from our own programs, especially the people of color. Minorities in Maryland are, look at the arrests for our Black men in the prison system just for cannabis charges alone. So on a federal level, changes are happening as well as they're happening at the local level. And the cannabis industry really is bringing a new way of carrying themselves. It's not about sales and making money. This is about changing our environment and the space that we live in. So it's kind of what we're looking at. So like I said, each county has a veterans treatment court. And these are for those veterans that are, become fallen prey to the legal system. They're troubled, they're trying to find their way. And these are just additional advantages that our community at large can help our veterans.
I think that's important thing to touch on is, a lot of times there's certain services out there that can help people in some of these fashions that a lot of people just aren't necessarily aware of. So a lot of times it's really good to try to get this information out there. We've been hosting these expungement clinics as, we've been discussing. And, there's ways for people to try to get themselves expunged. There's information out there to, you don't need necessarily to have an attorney to get these expungements done. And one thing that I've learned just in, our pursuit of getting these expungement clinics going is how important it is just to let people know about the services and the capabilities that they can have. And, it's important for, we feel like it's important for people like us to offer these expungement clinics just to make it easy, to make it, available. But it's also really important to know a lot of the different services that you mentioned there, Eryck, because I feel like there's a lot of, people that just don't realize the, what is actually at their disposal. So I really appreciate you bringing up those things, and we're happy to make sure that that information gets out to as many people as we can.
Warren, one of the things that you briefly mentioned earlier, if you could go into, we spoke about some of the things that we've done with Eryck and with the organization to help further some of the causes for the veteran community. and look at the type of legislation that we can actively have a hand in changing. Do you mind kind of going into a little bit more of that?
Sure. I've been lobbying at Annapolis. Me and Eryck have crossed paths more than a couple of times on the floor of the House building or in the Senate building down there in Annapolis. And, I can't state enough how important it is to really get out there and really talk to your legislators and talk to the people who represent you. And, some of the efforts that we've been trying to pursue, Eryck touched a lot on, the criminality and of marijuana and how it's affected so many people's lives, and our quest to try to make sure that we can get it legalized and make sure that people don't have to deal with the plight of having someone in their family or a friend, someone important to them, have to deal with the criminal element that can come with marijuana. And I think, of course, as we like to say, cannabis. But at the end of the day, I think it's one of the things that became aware to me. We happen to be located, in Rockville, right down the road from Walter Reed. And, we do have a lot of veterans in our community, right around the DC area. We have a lot of people who work with the federal government. We have a lot of people who were veterans or actively working in the military. And one of the questions that we, had to field repeatedly is the concern from veterans and people working for our government that, people coming to us and saying, I think I have a lot to gain from utilizing medical cannabis as a treatment for any of these variety of issues that I'm dealing with. But I'm really worried about losing my benefits, or I'm worried about losing my job. And so it's really been important to us to really make sure that our veteran community can have access to this. As Eryck mentioned, it can be a life-saving form of medication for a lot of these people, whether they're dealing from PTSD or a lot of different other ailments, and they're trying to get off of prescription medications or opioids or any other forms of medications that they are allowed to be prescribed without having to worry about losing their benefits and everything that they need for them to just succeed in life, get the treatment they need. So it has been important for us to really try to implement that change and actually reach out to our legislators and tell them how important this is to our community, our veteran community. And, I think people need to realize sometimes, even if this is an issue that you might not be going through yourself, someone is. And if, if anyone has had, I have family that are veterans. I have actually quite a few veterans in my family, and I've had a lot of discussions with them and a lot of the different trials and tribulations they've had to go through, and all for as they would view the pride and joy that they had for fighting for their country and upholding our freedoms. And it's something that brought them a tremendous amount of pride. And I think at the end of the day, we owe it to them to do what we can to make sure that they can live the best lives that they can after making those sacrifices. So, Eryck has been there, every step of the way, and really kind of pushing this narrative with a lot of our legislators. And I would just encourage anyone out there that might feel passionately about any number of these issues that we're going to be talking about today to please reach out to their legislators and really try to make sure that they understand that this is something that you want to see change as well.
Mm-hmm. Mm-hmm.
If I may add something I think is important here. So in Annapolis, we have the Veterans Caucus, and just last year alone, we had a roundtable at the summit, and each table was to present an idea on what the veteran legislators and delegates needed to be working on throughout the years. So we listed the top 10. Number 10 on the list was medical cannabis access for veterans. So even the Veterans Caucus has a site on it in the Annapolis area. So I encourage, like Warren said, get down, start making those phone calls, get active. And that's where policy changes happen, when we speak directly as citizens and as veterans to our legislators and delegates.
Mm-hmm. Mm-hmm. We know that many organizations, businesses, agencies, they require background checks for applicants. They require, investigation into your past to see if there's anything that could hinder anything from employment to applications to schools and colleges, housing, government services. We want to make sure that we're not causing more roadblocks for our veteran community to live the life, as Warren said, that they deserve to live, that they've, fought and sacrificed to live. So making sure that expungement clinic services are in place so that we can also help to remove any additional barriers, excuse me, that veterans may face is extremely important to us, and it should be important to everybody. In terms of additional legislative efforts, we've heard that full expungement or automatic removal can cost millions upon millions of dollars, and the pushback for that is just because it's expensive, we shouldn't do it. We've heard arguments like that before. What, in terms of your opinion, Eryck, Warren, what are some of the other things that you might have heard in addition to it being too expensive that you've heard in terms of barriers for expungement for either the veteran community or for the community at large?
A lot of it has to do with the administrative effort that goes into it. Veterans struggle, daily, sometimes even make it to their own medical appointments with some of their issues and some of their disabilities. So a lot of the expungement has to do with access to communications and capabilities that they just may not have. These guys and gals are suffering TBIs, PTSD. The last thing they can do is read a paragraph and digest it and translate it and put pen to paper. So things like the expungement clinic and other resources actually, I have to say, spoon feeding us sometimes to help us out. We may have given up hope. What do we care? We can't get a job anyway. What do I care? I have a record. And so we've already defeated ourselves. And so getting the word out there that expungement of your records is critical and important. It does free up some peace of mind, at least, and like you stated, opportunities that they may have given up on already. So
yeah, I can speak personally, and I've always this has always been something that's been important to me, but it really came to a head when we were getting involved, and I was personally testifying for some of the adult use legislature that was introduced last year. And as Kevin mentioned, there was this discussion. A lot of these bills actually had automatic expungement included in them originally. And as he kind of addressed, there was a lot of discussion about, automatic expungement, it being too expensive. There was a lot of discussions behind the reasons of its expense, which, there's a lot of miscommunication or lack of communication entirely with certain databases that, our court systems use. And, our police system doesn't necessarily communicate to our court system. And, they kind of would stress the fact that these systems not communicating properly was one of the main reasons that, automatic expungement would be such a large obstacle or a large project to tackle, and that it would be so expensive. And I can speak personally that when I was testifying and listening to this, the different testimony on this different adult use legislation, that's when I had the idea that hey, if we can't get the Maryland government to basically have automatic expungement introduced with this, then I'm going to do what I can, and I'm going to, Peake ReLeaf as an organization, and we've been lucky enough to have a lot of other organizations help us out with this as well, as you can see with a lot of the different graphics that we've been introducing, to really try to take at least a piece of this for ourselves and try to contribute as much as we can to make sure that people can get their records expunged. Because, as Eryck and Kevin, we've been reiterating it a couple of times, finding meaningful employment, finding, cheap housing, people who possibly can't get into a university or some sort of, organization they might want to be able to contribute to just because they might have some sort of criminal record that in a lot of ways isn't necessarily even criminal anymore, and most certainly in a vast majority of our country. So I think it's time, that I hope that we can get the Maryland legislature and the General Assembly to really take this up and honestly put a higher focus on getting these records automatically expunged when hopefully we can get some adult use legislation passed. But until then, I feel very confident, and that we're going to be able to do the best we can to try to offer this to our community and hopefully change some lives. That's why I'm here. That's why all of us are here.
Mm-hmm. Yeah, definitely. We're, being in the cannabis industry, to Eryck's point he mentioned before, it's not just, who can make the most money in the shortest amount of time. We're actually more in the business of quality of life, and we're in the business of improving the conditions in which people live. And to that point, even with expungement clinics, I don't want anyone that sees our efforts to think that expungement clinics are the end of the assistance that we want to be able to provide. At the end of the day, expungement is just another piece of healing from the war on drugs. It's a small piece of addressing the concerns within the veteran community and providing the resources for a better quality of life. But we also have to talk about reentry after expungement. Maybe there has been some things that have been expunged from a criminal record that have prohibited the people that have had those criminal records from pursuing employment or schools and colleges, to relationships, to housing, or, like I said, other government services. What other things can we do to help with reentry into those areas? Can we provide employment? Can we provide assistance for those that need housing? Can we work with local organizations like the Coalition for the Homeless in Montgomery County? Can we, what else can we do that goes along with these expungement clinics? And, I'd be interested to hear what, both of you think in terms of, post expungement clinic. What are some of the things that you would like to see for these communities that are being served?
I think, honestly, deeper engagement in the community, which you're already doing. I would say start sitting on the boards of the local communities that dispensaries are in, start becoming the voice of the community, and help transition the community into a more, end the stigma state. There's still a lot of problems out there. People still don't believe that cannabis is medicine and can save lives. So just deeper engagement, for our veterans, when you're going to the doctor, or you're going to the vet clinic, or you're going to the VFW, the American Legion, the DAV, AMVETS, and you're a patient, don't be afraid to talk about cannabis, because that's where the policy needs to change. I talk to my doctors every time I go about my cannabis usage. That's something that I do as a personal reason, as an advocate as well. And it's important for our doctors to know what's going on with our healthcare. That way they give us better treatment. So, the next steps is continue to educate the industry, meaning the government, about the properties and healing benefits of medical cannabis.
Well, I was really happy to hear you bring up like the Veterans Caucus within the General Assembly, because I think you raised a really great point. We're members of a couple different groups throughout the community, chambers of commerce and things of that nature as well. And I think that it's been important to us. We've been members of a lot of those organizations since our business has opened. And we had going back, kind of reversing the reel a bit. We had the Rockville and the Greater Bethesda Chamber of Commerce at our ribbon cutting. We had a ribbon cutting. It's one of those things that might not seem important to a lot of people, but it was very important to me to make people understand that this was a necessary business. This was a legal business. This was a business that was out here, and this is an industry that's looking to help people. And I can speak personally of our dispensary and our organization, that it was important for us to make sure that the community knew, and that these organizations knew that this is legitimate. We are here. We want to be a part of our community, and we want to be beneficial to not only anything surrounding about medical cannabis, but a lot of these other issues as well. So, as many people that we can get to kind of discuss these issues, as many, and that's why I thought the Veterans Caucus was important. The more veterans that we can get to really actually communicate in these organizations and talk with these people and speak about their personal struggles, or the struggles of some of their service men and women that they might have actually served with. Those discussions are what is most important, in my opinion, in ending the stigma and really kind of furthering some of these policies that are going to be beneficial. In my opinion, when we first opened, there was still a pretty significant stigma surrounding medical cannabis. And just in the 3 years plus that we've been open, I can personally see there is that stigma that's still there. It has not gone away, but it has changed significantly. I remember some of these different we'd have a pop-up at a local festival or something like that. And, I would kind of get the stink eye from time to time from some people in the community. And then as this kind of progressed and the years went by, all of a sudden, someone had a brother or an uncle or a grandma or a grandfather that was a medical cannabis patient and saw just such a huge benefit to their life. And, even as, we can provide some medical information and some studies and things of that nature to doctors. But to be completely honest, to your point, Eryck, I think what really changes these opinions is for them to have a patient that they've been serving for 20 years, come to them with these struggles and have them actually really tell them, hey, I started using medical cannabis and it has changed my life and this is why. And I think that that's why we started to really kind of see some of the stigma change and some of these doctors start to change their opinions and actually open their minds that this could be a great benefit. And so I think that as long as we can kind of continue and get more and more people to feel open and actually feel honestly some pride in the fact that this is what I've been doing and this is what's been successful, and trying to get that message out there more. I think that's what really is going to actually start to initiate more of this change that we're going to see within the industry and honestly beyond. So very happy to hear that you're doing that, Eryck, and I would encourage everybody else to kind of be more open and speak to their physicians and their friends and family as well.
Definitely. In closing, just to kind of, wrap everything up, when you have a criminal record, we know that you never know who's like looking at your information. It could be employers, it could be people that are your neighbor that just happen to be a little nosy. It could be, a curious acquaintance, or, it could be anybody. So just like there's a level of transparency with your criminal record, there should be a level of transparency in the type of help that you're able to get, and removing the stigma so you don't have to feel like you have to hide what is helping you. And I think that kind of touches on, some of those points that you mentioned, Warren, is that we want to make sure that through the expungement clinics that we're not only relieving some of the legal ramifications of someone's decision, that we're providing care, that we're providing support, providing, maybe some methods of reentry post-expungement, but we're also helping to remove some of the stigma that's associated with cannabis use, as well as, someone just making a mistake and being penalized for it beyond what should be reasonable in many cases, based on a variety of factors, including the color of their skin. So, in closing, is there anything else that you would like to kind of share for the people that are watching about the expungement clinic, or, anything that you would like to kind of stress as we kind of, bring the conversation to a close?
Yeah, certainly. It was important for us to be able to have this discussion today, and that's why, once again, I'd like to thank Eryck for coming. Kevin, thank you for moderating this and being involved with this as well. And I think, one thing that, Eryck gave us the opportunity is, as we mentioned when we first started this, it's great to be able to hold this expungement clinic, but, that's not where assisting this community starts and stops. There's always more that can be done. And so, we get a lot of pride, and we'd like to have other people join us and help supporting Veterans Initiative 22 and the important work they're doing, and becoming a consistent partner or trying to contribute however they can to their organization. So it's one thing that we've been very happy that we've been able to help and however we can and assist with them. And once again, I just encourage, people to look out there and reach out to Veterans Initiative 22 and try to see how they might be able to help if they have someone who they think that could to help, or if they just think that they can make a meaningful contribution to something that will be able to benefit our community and our veterans community as well. So once again, I really appreciate you coming and participating in this, Eryck, and I hope that we get this out to a couple people who hopefully can get some benefit from it and maybe get encouraged to, put their feet on the pavement, and whether they're going out and speaking to a legislator, making some phone calls, or sending an email, or helping you volunteer in some sort of method that might be able to benefit the veterans community, or making a monetary contribution. I mean, every little bit of that, can help our community and really hopefully get to us in a better place. So once again, I really, really appreciate you all being here.
Thank you so much, Warren and Kevin. It's been a pleasure to speak. Not typical for me to talk legal issues So it's exciting to be able to extend my wings a little bit, and this allows me to expand our own horizons on what can we be doing better as a nonprofit to continue that support to our veteran community. We put up our blinders too at times as we're marching down the path to our own mission. And with a small staff, and we're always looking for volunteers to support the mission, is to extend our own doors, to broaden our own scope and keep expungement clinic discussion. Sharing like we have today is one way to expand that out. So it's been a pleasure.
Definitely. And lastly, one thing I would definitely stress for everybody that's watching, if you are, picking up your medicine from a dispensary, if you have a favorite company, don't be afraid to ask them what they're doing to help the community. Don't be afraid to ask for a level of transparency and accountability in terms of what they're doing. If they're willing to accept your money, then they can accept your suggestions on how to improve, their placement in the community, their relationship with the community that they're a part of, and, communities that they, serve, and how they can do that better. So I would encourage everyone to, don't be shy in asking for more expungement clinics, for more veteran outreach initiatives, for more homelessness alleviation, for helping food drives, for whatever the case may be, for campaigning for more patient rights. Whatever is important to you in relation to this industry, there's a place for it, and there's a place for a business that exists in this industry to be a part of it. So I would, again, I would stress that if you have a favorite place to go, make sure that you also are aware of what they're doing, and if they're not doing enough, let them know. Let them know. So again, thank you to Warren and Eryck for joining us today. And we have, like I said, the expungement clinic coming up. Following this video, you'll see some additional information about that and where you can register if you haven't already. And please continue to spread the word. We want to make sure that we're able to serve as many people as possible. This will be our third expungement clinic. And we're not showing any signs of stopping anytime soon. So as you can see through the background here, there's more logos for participating partners. And the more we do these, we're hopeful that we'll see even more. My wish is that, this whole virtual background be filled with, every logo from every dispensary, grow and processor in the state of Maryland, because they have a
background.
Yeah,
I was going to say, let that background not be a clean slate. Let it be.
Exactly.
That means
Exactly.
The mission's getting accomplished.
Exactly. So that's definitely my goal, and I'm sure the goal of everyone at Peake ReLeaf and many of the participating partners that you see right up there. So again, thank you both for joining me today, and we'll see you in the next episode of this as we continue our efforts for the expungement clinic. So thank you very much.
Thank you all.
Bye-bye.